an inherited disorder where red cells sickle and block vessels. Causes painful vaso-occlusive crises. Hydration, oxygen, and pain control are priorities. What is this word? The brain. The control center of the nervous system, with the cerebrum, cerebellum, and brainstem. Know each region's role. The brainstem controls vital functions like breathing. What is this word? Routes of drug administration. The path a drug takes into the body: oral, 4, IM, subcutaneous, topical, and more. Route affects onset and bioavailability. No 4 is fastest. Some drugs are route-specific. What is this word? Tricyclic antidepressants. Older antidepressants like amitriptyline. Dangerous in overdose, causing cardiac and anticholinergic effects. Monitor for arrhythmias. What is this word? Corticosteroids. Anti-inflammatory drugs ending in -sone that suppress immune and inflammatory responses. Cause high glucose, infection risk, and never stop abruptly. Taper slowly to avoid adrenal crisis. What is this word? Diuretics. Drugs that increase urine output to remove fluid, including loop, thiazide, and potassium-sparing types. Loop diuretics like furosemide waste potassium, monitor levels and daily weights. Give earlier in the day. What is this word? The eye and vision. The organ of sight that focuses light onto the retina. The retina converts light to signals. No refraction errors and the optic nerve pathway. What is this word? Disseminated intravascular coagulation. Widespread clotting that then uses up factors, causing bleeding. A life-threatening paradox, clots and bleeds at once. Triggered by sepsis and trauma. What is this word? Antiemetics. Drugs like ondansetron that prevent nausea and vomiting. Ondansetron can prolong the QT interval. Match the drug to the cause of nausea. What is this word? Insulin types and timing. Insulins classed by onset: rapid, short, intermediate, and long-acting. Match insulin to meals and no peak times when hypoglycemia strikes. Only regular insulin is 4. What is this word? Congenital heart defects. Structural heart problems present at birth. Classified by whether they cause cyanosis. Alter normal blood flow through the heart. What is this word? Digesting carbs, proteins, and fats. How each macronutrient is broken down into absorbable units. Carbs to sugars, proteins to amino acids, fats to fatty acids. Different enzymes for each. What is this word? Metformin and biguanidase. First-line type 2 diabetes drugs that reduce liver glucose output. Rare risk of lactic acidosis. Hold before contrast dye. Doesn't cause hypoglycemia alone. What is this word? The lymphatic system. A network that drains excess fluid and supports immunity. Returns fluid to blood and filters pathogens in lymph nodes. Links to edema and immune defense. What is this word? Metastasis. The spread of cancer from its origin to distant body sites. Occurs via blood and lymph. It defines advanced cancer and worsens prognosis. What is this word? Anemia. Too few red cells or too little hemoglobin to carry oxygen. Causes fatigue and pallor. Know the types: iron deficiency, B12, and chronic disease. What is this word? Neurological assessment. Evaluation of consciousness, orientation, pupils, motor and sensory function, and reflexes. A change in level of consciousness is the earliest and most sensitive sign of neurological decline, so act on it first. What is this word? The kidneys. Paired organs that filter blood, make urine, and balance fluids and electrolytes. Also control blood pressure and make erythropoietin. Central to fluid and acid-base balance. What is this word? Pediatric dosing principles. Drug dosing in children, usually by weight in milligrams per kilogram. Always double-check calculations. Children are more sensitive. A common medication safety question. What is this word? Pain assessment. Evaluating pain with tools like the 0 to 10 scale, PQRST, and FACES scales for those who can't speak. Pain is whatever the patient says it is. Believe the report, treat it, and always reassess after intervening. What is this word? Parkinson's disease. Loss of dopamine neurons causing tremor, rigidity, and slow movement. Know the classic triad and that levodopa boosts dopamine. A progressive movement disorder. What is this word? Inflammatory bowel disease drugs. Medications like aminosalicylates and biologics that calm gut inflammation. Biologics raise infection risk. Screen for TB first. Steroids are for flares, not maintenance. What is this word? The male reproductive system. Organs that produce sperm and testosterone. The testes make sperm and hormone. Know the pathway sperm travel. What is this word? Cardiomyopathies. Diseases of the heart muscle itself, dilated, hypertrophic, and restrictive. Each impairs pumping differently. Hypertrophic can cause sudden death in young athletes. What is this word? Opioid analgesics. Strong pain medications like morphine that act on opioid receptors. The key danger is respiratory depression. The antidote is naloxone. Monitor respirations and sedation before redosing. What is this word? Fall prevention. Strategies to reduce patient falls, such as bed alarms, low beds, and non-slip footwear. Safety is always a priority. Identify high-risk patients, keep call lights in reach, and answer calls promptly. What is this word? Bioavailability. The fraction of a drug dose that reaches the bloodstream unchanged. 4 drugs are 100% bioavailable. Oral drugs less due to first-pass metabolism. Tested with route comparisons. What is this word? Antihistamines. Drugs that block histamine for allergies, like diphenhydramine. First-generation ones cause sedation and anticholinergic effects. Second-generation are non-drowsy. What is this word? Hypersensitivity reactions. Exaggerated immune responses causing tissue damage in 4 types. Type 1 is allergy and anaphylaxis. Know the 4 types and examples. What is this word? The cranial nerves. 12 pairs of nerves emerging from the brain for the head and neck. Know the numbers and functions, tested with deficits. The vagus nerve is number 10. What is this word? Circulatory shock. Inadequate tissue perfusion and oxygen delivery with several types. No hypovolemic, cardiogenic, and distributive shock. Early recognition saves lives. What is this word? Diffusion and osmosis. Diffusion is solute moving down its gradient. Osmosis is water moving across a membrane. Drives 4 fluid effects: isotonic, hypotonic, and hypertonic solutions. A high-yield concept. What is this word? Sodium imbalance. Abnormal blood sodium, either low, called hyponatremia, or high, called hypernatremia. Both alter mental status and seizure risk. Correct sodium slowly to avoid dangerous brain shifts. What is this word? Four fluids. Solutions given into a vein, classed as isotonic, hypotonic, or hypertonic, to restore fluid and electrolytes. Match the fluid to the problem. Isotonic, like normal saline, stays in vessels. Hypotonic hydrates cells. What is this word? Increased intracranial pressure. Elevated pressure inside the skull that reduces blood flow to the brain. Late signs are Cushing's triad and a falling consciousness. Elevate the head and avoid activities that raise pressure. What is this word? GLP-1 agonists. Injectable diabetes drugs ending in tide that lower glucose and weight. Slow gastric emptying and cause nausea. Watch for pancreatitis, increasingly used for weight loss. What is this word? Anticholinergic inhalers. Bronchodilators like ipratropium used mainly in COPD. Cause dry mouth, a maintenance drug, not a rescue inhaler. Caution in glaucoma. What is this word? The black box warning. The FDA's strongest warning about a drug's serious or life-threatening risks signals the most important safety teaching. No examples like antidepressants and suicide risk in youth. What is this word? Cushing syndrome. Excess cortisol from disease or steroid use causes moon face, central obesity, high glucose, and thin skin, often from long steroid therapy. What is this word? Potassium imbalance. Abnormal blood potassium, either low, called hypokalemia, or high, called hyperkalemia. Both cause dangerous dysrhythmias. Never give 4 potassium as a fast push. Watch ECG, changes like peaked T waves. What is this word? Lung sounds. Breath sounds heard on auscultation, from normal to abnormal, sounds like crackles, wheezes, and stridor. Crackles mean fluid, as in heart failure or pneumonia. Wheeze means narrowing, and stridor is an upper airway emergency. What is this word? Anticoagulants. Drugs like heparin and warfarin that prevent clot formation and growth. Know the antidotes: protamine for heparin, vitamin K for warfarin. Monitor APT for heparin and INR for warfarin. What is this word? Croup and epiglottitis. Pediatric airway conditions: croup with a barking cough, epiglottitis a rapid airway emergency. Never put anything in the throat of a child with epiglottitis. Drooling and tripod posture are red flags. What is this word? Deep vein thrombosis. A blood clot in a deep vein, usually the leg, that can travel to the lungs. Never massage a suspected clot. Prevent with early mobility and anticoagulation. Watch for a pulmonary embolism. What is this word? Thyroid replacement. Levothyroxine replaces thyroid hormone in hypothyroidism. Take on an empty stomach, same time daily, for life. Watch for signs of over-replacement. What is this word? Active transport. Moving substances against their gradient using energy from ATP. Contrasts with passive diffusion. The sodium-potassium pump is the classic example. What is this word? CPR and the chain of survival. Life-saving steps for cardiac arrest, early recognition, CPR, defibrillation, and advanced care. Push hard and fast, 100 to 120 per minute. Early high-quality compressions and defibrillation save lives. What is this word? Inflammatory bowel disease. Chronic gut inflammation, Crohn's disease, and ulcerative colitis. Know the differences. Crohn skips areas, colitis is continuous. Both risk flares and complications. What is this word? How pulmonary embolism blocks flow. A clot lodged in the lung arteries, blocking blood flow. causes sudden breathlessness and low oxygen, often from a leg DVT, a high-priority emergency. What is this word? The spinal cord. The nerve bundle carrying signals between brain and body. Ascending tracts sense, descending tracts move. Injury level predicts the deficit. What is this word? Penicillins. Bactericidal antibiotics that disrupt the bacterial cell wall. The classic allergy drug. Ask about reactions and watch for cross-sensitivity with cephalosporins. What is this word? How cirrhosis scars the liver. Irreversible scarring that replaces healthy liver tissue. Causes portal hypertension, ascites, and bleeding varices. End-stage liver failure. What is this word? Addison's disease. Adrenal insufficiency with too little cortisol and aldosterone. Causes fatigue, low blood pressure, and skin darkening. An Addisonian crisis is a life-threatening emergency. What is this word? The neuromuscular junction.